Chase Campbell talked to the team about their work.
It's been 1 month since Westbrook Health Services launched its 24/7 mobile crisis response program, and the team is settling into their expanded schedule while fine-tuning their approaches to meeting people in crisis wherever they are. The program sends trained crisis specialists directly to people experiencing mental health or substance abuse emergencies, offering an alternative to traditional emergency room visits or law enforcement-only responses. Crisis specialists Ashley December and George Bogus say the mobile approach removes barriers that often prevent people from seeking help.
I think there's a stigma with mental health and substance abuse about, reaching out and getting that help. It can be hard for some people, but I think that, just reaching out is the first step. You just got to know that there's always someone in the community that cares.
A lot of times people don't know what resources are available, so it kind of just bridges that initial gap of, I know I need help, but I'm not sure the avenue to take.
The team emphasizes that hospitalization isn't always the goal. Children's crisis specialist Cecilia Frank says success often looks different than people might expect.
Successful response is de-escalating and stabilizing someone and making them feel safe where they are. We don't have to send them anywhere. Hospitalization is never our goal. That's just an option, a resource that we have when we're unable to have them feel safe.
Crisis specialist Laura Butcher describes the range of issues the team encounters.
It's just typically somebody struggling with their mental health or substance use. It could be homelessness, domestic violence. It could be a wide variety of things, just barriers to getting into treatment, whether it be inpatient or outpatient.
The program works closely with police, providing a healthcare-focused complement to traditional law enforcement response. Butcher says this partnership helps distinguish between criminal matters and mental health crises.
Whenever somebody sees an officer, they automatically think, I'm going to be arrested, I'm in trouble, something's going on. So it makes it a little easier whenever they kind of stand back and we go and speak with them.
Bogus explains that the presence of law enforcement can add stress to a crisis situation, but the team serves as a bridge.
Sometimes it's just kind of a translation between what the person's saying to the police officer. It's just a little more laid back, and I'm not threatening.
Youth peer mentor Sunshine Ham brings a unique perspective to the Children's Mobile Crisis team, drawing on her own lived experience with mental health struggles.
I have the lived experience of it, so where all of the other crisis workers will have their degree and they are familiar with working in the field and things like that. I have the lived experience of it, so that coupled with the things that I've been through in my life helped me be able to do what I do as a job.
Ham says working with children often comes down to something simple.
But a lot of times kids just need somebody who cares. So a lot of times when we talk to kiddos, they really just want somebody to sit there and listen to what they have to say. So I think even being a shoulder for them to cry on, or somebody that they know is there fully for them to listen to, is very beneficial.
Team members acknowledge the emotional toll of crisis work and emphasize the importance of self-care and peer support.
With being in the position that I have for as long as I have, I've had various clients who go through, some very emotionally exhausting experiences, and sometimes you do take that home with you and you take it, past clock out time. But I think really just engaging in self-care and just kind of leaving with the idea that, I've helped this person in some way.
Bogus adds that the team support is crucial.
All my coworkers are amazing, and we find a way to help each other through on the difficult days. Sometimes it's you just kind of have to find the comedy in the tragedy.
While the 24/7 expansion is still new, team members report they're already making a difference.
We're not perfect, but we do a lot of good work. At the end of the day, I see a lot of people that get what they need. So it's really amazing to be a part of that.
The team can be reached through their 24/7 crisis line at 304-485-1725, which also accepts text messages. In Parkersburg, Chase Campbell, WTAP News.
WTAP looks back on this day in history.